Hey everyone, it's Mary Ann Pizzatola from the New York City Organization of Public Service Retirees. And today I have Tommy Scotto with me. Say hi, Tommy, and introduce yourself.
How you doing? Tom Scotto. I was the president of New York City Detectives from 1983 to 2004.
Wonderful. So today we're going to have a conversation. You were teaching me about assumption rate. You'd come up with a suggestion some time ago on how to fund some of the aspects of collective bargaining agreements, or in this situation, retiree healthcare or healthcare for the active workers. So tell us what your suggestion was.
Well, let me give you a little history. The Municipal Labor Council, MLC, was formed many years ago, I think in the 80s, if not mistaken. And
1966.
the basic
actually.
principle of that is so that instead of the city negotiating with thousands of unions, the MLC was created so that the city would negotiate health benefits with one umbrella group that would in essence affect everyone in the all city employees, to put it in a nutshell. Okay, now what has happened over the years, it's important to know that there was an establishment of the stabilization fund. I was part of that creation, and that was established to offset any unanticipated increases in health coverage. So you didn't have to go back to the unions to constantly modify the health benefits to the members.
Right.
Hence, that's what it was created for, and that's what it was supposed to be used for. However, someone in the 90s, I believe, the teachers union was behind the eight ball, and they decided to try to access the Municipal Labor Committee's stabilization fund money to offset their cost factors. And they, in a private meeting with Jim Hanley at the time, God rest his soul, great guy, decided to see how they could access that money. And Jim Hanley, being skilled as he is as a city negotiator, said to them, "We'll tell you what, we'll let you access $100 per member, provided we access $100,000 a member, $100 rather." So hence there was an agreement that the unions would give the city $300 million to access $300 million for the union members, which was a total mistake. And I may add, and I'll say it proudly, out of the vote on the Municipal Labor Committee, I was the only one who voted against it, and a very, very, very heated exchange between myself and then Randy Weingarten. And ultimately, a lot of the unions went along with her suggestion to sell it. And I could never understand why we had to give $300 million of our money to the city to get $300 million of our money. The worst thing, and I said then, and I'll say it again now, I said to everyone at that table, there'll come a day you will regret what you did today. And here it is. Came home to roost, okay? Now, having said that, the issue with what's going on now with the retirees, listen, I know a lot of these people on the MLC. They're all good union leaders. They're all well-intentioned. They have no desire to hurt anyone.
Right.
The problem with this issue is they negotiated, and underscore the word negotiated a salary increase for their active members at the expense of the retired members, which is absurd, in my opinion, as a former union leader.
I agree.
Because every one of your union active members becomes a retired member. Hence, I don't understand the logic behind it, because every active member that's getting an instant gratification right now in a salary increase will now pay for the rest of their life. For the life of me, I can't understand that one. It doesn't make any common sense to me. Now, using the word that I said before, negotiated. They negotiated themselves into this corner. They should negotiate themselves out of this corner. And the easy way out was, all right, screw the retirees, and let's make it appear like it's going to be better for them than it is. It's not better for than what it is. We have a plan that is completely funded by the federal government. And the federal government is responsible for all the cost factors. Now, when you take the plan and put it into a for-profit organization like Aetna, you know sooner or later they're going to say there was excess use. I've been through this for over 30, 40 years. There's excess use. There's a need for an increase, and it's going to fall on the shoulders of the retirees. And the way they program this is amazing to me, that if you want to stay in the plan that you are, you have to pay $192, $190
That was the beginning. That was their first
per
proposal.
person.
Right.
And you lose the supplemental rebates that you get.
If you waive your
And
benefits.
a lot of these
Yeah.
retirees, they're only getting $8,000 to $10,000 a year. They're not high-end retirees. They can't afford this kind of money.
Right.
So I don't think any of the union presidents meant to hurt the retirees. I don't think it was well thought out. Now, let's get back to what I said before. They negotiated a problem. Negotiate out of it. Now, one of the avenues I tell them that they could generate those funds is in the actuarial assumption rates. We've done it before. The stock market is doing very well. It's starting to come back again. You increase the actuarial assumption rate and you generate the $600 million. Now, how do you do that? The actuary for the city of New York, who works for both the unions and the city, does an analysis and a projection, a 5-year projection, as to what the stock market will do. And in that regards, you could put it up a 16th of a point or an 1/8 of a point, and that generates hundreds of millions of dollars. So if they're looking for an avenue, a possible avenue to resolve this $600 million a year, that is an excellent way to do it. Nobody gets hurt. The pension fund is still completely funded, and they resolve this issue. And the other thing that gets me is the fact that we went to court, and the court already ruled in the retirees' favor. That's a perfect out for all those unions inside the MLC that said they voted no. So support the judge's decision and say, okay, they went to court and they won. Let us figure out another way to resolve this issue rather than continue to appeal this and go further.
I agree with you, but I've said this many times. That last 2018 MLC agreement, they committed themselves to a recurring $600 million in savings without ever outlining how they would do it. They had suggestions, but there was also no blow-up clause. They accounted for what would happen if they made too much money, but they didn't account for what would happen if they didn't make enough. And I think that the grounds of that negotiation could be considered faulty. And clearly, a judge has decided multiple times that what they were trying to do was illegal. So why don't they? I think the responsible thing to do for labor relations and the MLC is to, behind a closed door, since this was their negotiation, to say, this was faulty. Let's go back and fix this.
Well, that's what they're supposed to do, is fix it, man.
Yeah.
But what they decided to do, well, the easiest way out is we'll just put it on the shoulders of the retirees. That was not that. When I was in negotiations for over 25 years, whenever we sat down to negotiate, the city would always say, we'd like to discuss the retirees. And I said, there are no discussions regarding retirees. This session is over with. Only call me back when that is removed from the table. There is no discussion regarding retirees. And in fact, the law says the unions do not negotiate for retired members. So, I mean, that fact alone is always going to convince the courts, well, wait a minute, how is this being modified? It's being modified because the unions negotiated a modification for the retirees. The law says you have no right to negotiate the benefits of retirement. You can enhance their benefits, but you can't reduce their benefits. So what they're arguing is, we're enhancing their benefits. They are not. They're being misled over the fact that they're going to go into a for-profit program, which in essence means every time there's a cost factor, they're going to have to pay for it. Whereas how come they always said to us, we have a Cadillac program as a retired member of the city of New York?
Medicare.
So if we got the Cadillac program, what are they going to give us? A Rolls Royce program? It's not going to happen.
This is a Pinto.
We'll wind up with a Pinto program. That's what's going to happen.
This is a
And like I
pinto.
said, and I have to repeat this, I know a lot of those members of the MLC that support this. Some of them are even current clients of mine. They are all well-intended. I just think they're misinformed and they're going down the wrong path.
Yeah.
Now, if all your retirees are happy with what they have, leave them alone. Now, a lot of the people in Florida, which a great large number of retirees migrate to sooner or later, they have already said, many of the plans in Florida, they will not accept the Aetna program.
Right.
So now what are these people supposed to do? If they want to continue with their same doctors, their same plans, and they're being told, if you go into the Aetna program, you better find somebody else. That's not fair to them. It's just not fair, and it's not equitable. And the union's got a great argument that the courts already ruled against them. They should not support the mayor in appealing those decisions. They should try to figure a way out of it.
I agree with you. They
if they need any help, my services are free. I'll come in and show you how to do it without hurting anybody.
I love it. Yeah, half the counties in Florida that there's basically a desert of the Aetna network or doctors and hospitals, like even Mayo clinics, this becomes frustrating because when you're at this stage of your life, you don't want to have to hunt for a doctor. You want convenience. You're not going to want to find a doctor that's an hour away when you're 70, 80 years old, to have to keep commuting an hour plus to find a physician or to get to that doctor's office that accepts your plan. That's dangerous. And you shouldn't be putting that burden on a senior. And they're not understanding this. When I sat at a council meeting the other day, many in the Progressive Caucus said to me, well, you should just the city was just going to force you into that Aetna Medicare Advantage plan for 12 months. And you should accept that. And we were like horrified by his statement. And we said to him, so you're okay with someone who's a senior or disabled, who is undergoing life-saving care, to all of a sudden be forced into a plan that their doctor or hospital doesn't accept just because it's for 12 months. By the time that 12 months is over, that person could be harmed or dead. That's not a solution. And yet, I even confronted Gloria Middleton from CWA 1180 that same week. And she's like, we disagree. But what are you disagreeing upon? If I'm telling you, that the city of New York always offered employees and retirees a choice of plans, and the cover in the front of the SPD would always say, here's these wonderful choices of plans for you. Choose the one that works for your family. To choose the plan, whether it was the health plan, the drug plan, whatever worked for you. You were never forced into anything. So then the gentleman from the council said, well, they do it for the young people. Well, the MLC chose to auto-enroll all new hires into HIP HMO. Well, the difference between someone like us and a 20, 30-year-old is the 20, 30-year-old is young and healthy and probably doesn't really use their healthcare. They're not finding issues of prior authorization denials or network issues. They're probably not even going to the doctor at 20-something years old. So in our generation, our situations are a little bit more different, and we don't have that luxury of just not going to the doctor. So I think there's a difference, there's a disconnect of the needs of an active young person and an older person or disabled person, and they're not recognizing that. That young person may not mind driving from Brooklyn to Long Island or Brooklyn to Manhattan or Harlem for a doctor. But for someone who's 70, 80 years old, that travel, whether they're in New York City or they're out of New York City, can be extremely prohibitive, especially if they're not driving and they don't have anyone to take them, or they're in a more rural area and there's no buses or trains.
No. Listen, I agree wholeheartedly with you. Again, having been a labor leader and knowing a lot of the people that are still in the Municipal Labor Committee, I think it's all well intended, but misunderstood. And I think the tampering with the stabilization fund right from the beginning, which was not intended to be used the way they used it, caused this problem in the first place.
I agree with you.
So again, they negotiated agreements and they touched a gold, you know, it reminds me of the fable with the goose with the golden egg, the golden eggs, and they killed the golden goose to get all the eggs, and now they have nothing. That's exactly what happened here. I fought like all hell to stop tampering with the stabilization fund. But as a DEA, I had a very small voice in the Municipal Labor Committee.
Yeah.
And the Municipal Labor Committee is in desperate need of restructuring the vote practice, because one vote per every 250 people allowed DC 37, which has the Big Five incorporated it, and the teachers to rule the whole vote. Aside from the fact that the PBA tried on 2 occasions to remove itself from the MLC, and on both occasions the court ruled against them and said the city of New York is not going to negotiate with thousands of unions. You're under that umbrella. Change the vote in the umbrella, and then perhaps you could fix it. So there's a default in the Municipal Labor Committee's voting process, because technically, if the teachers and DC 37 go along with a matter, you got voices at the table that could express an opposition opinion, but it makes little difference if it's, and most of the times they're preordained. They get together beforehand. They know what they're going to do. You're wasting your breath, as it was proven when I argued not to tamper with the stabilization fund in the beginning. That was already preordained. They spoke to the Big Five, the DC 37, the teachers, and they destroyed the stabilization fund, period. Fix it.
Hallelujah.
Fix it. I'll show you how to do it. Fix it.
There you go.
It's not that hard.
That's
and
it.
they just got a 5-year, most of the unions just got a 5-year deal, negotiated deals. They could have took a very small percentage out of each one of those contracts.
Amen,
and
brother.
fix this problem. They didn't want to do it. They
No.
took the full amounts and gave it to as salary increases. And why not do a per capita? You don't want to see DC 37 do that. You don't like to see the municipal, the teachers do that. They don't want to do a per capita. They've had to do percentages across the board because it's to their advantage all the time. Right?
Explain
why not a per capita? And you'll see all the small unions come out of it very easily without that much of a problem. Right?
Explain what a per capita is. Explain what a per capita is.
Per capita is they generate $600 million as needed, and they go across the board. How much does DC 37 pay? How much does the teachers pay? And then you get down to the small unions with only 200, 300 members. They don't pay anything. Nothing.
Compared to, so it's based on head count. Yeah.
Yeah. They don't want to do that. They'd rather do a percentage across the board rather than a per capita across the board.
I think they need to invite you to a coffee.
I'd be more than glad to come before the MLC. I challenge you. Let me come before the MLC. I'd like to be heard and spoken.
Yes, I would like that too. Is there anything you want to add before we close?
No, the bottom line, you negotiated this problem, negotiate it out. Don't put it on the shoulders of the retirees. I'll show you a way how to get out of it without doing that.
So MLC, Harry, Henry, Michael, give Tommy a call.
I know, Harry. Harry and I grew up together in the old neighborhood. I know him very well. Okay. And I know a lot of the people sitting there are current clients of mine, all well-intended, but misinformed.
I agree with you there. I do believe that is the case. And I think if they were to actually listen, we've been saying this for 2.5 years, but if they were actually open to listening why this is bad, and we can help guide them out of this hole, this might actually work. So,
you're not gonna convince them if they believe they're giving a retiree better benefits than they have, right?
I agree with
That's
you.
their argument. It's better than what you had. It's not. They believe it is, but I don't think so.
I agree. Well, everyone, you heard it from Tommy. Thank you for listening, and we'll be back with another one.
My pleasure.